I want to give a quick update here on testing. Yesterday, the Commonwealth conducted nearly 6,000 new tests, which brings our total tests statewide to about 175,000. The state reported 1,556 new cases of COVID-19 for a total of just over 41,000 positive cases. The last few days, we've seen fewer or about the same number of positive cases day to day, but we think it's too soon to draw a conclusion from that data. First, a few days does not represent a trend. We've seen this data bounce around before. And secondly, the number of positive tests is entirely dependent on who you test. And what I mean by that is daily positive test totals don't necessarily represent what's happening across the entire Commonwealth. Today's announcement on increased testing should help expand the universe of testing, and in many ways will be one more element of how we think about hotspots and opportunities to engage and to intervene. The piece of data we watch most closely is the number of hospitalizations for COVID-19. And we're still seeing an increase, a modest one, but an increase there statewide. Since the end of February, we've increased testing capacity dramatically through the State Public Health Lab and a wide range of lab partners at academic medical centers, commercial labs, the Broad Institute, and others. We now have more than 30 partners that are testing each day. Massachusetts remains a national leader in per capita testing, and we're continuing and committed to building on this work. Part of our statewide monitoring focuses on hotspots or high-density areas where the virus can spread quickly. And we've worked with local partners to address testing needs in several of these high-density areas. In Chelsea, Massachusetts General Hospital worked to quadruple testing capacity and to provide testing in housing developments. The Commonwealth, through the National Guard, also did mobile testing in Chelsea as well. In Lowell, we worked with CVS and the federal government to stand up a rapid testing pilot with the ability to test up to 1,000 individuals a day. The National Guard and Fallon EMS continue to test patients and staff at state hospitals, long-term care facilities, assisted living facilities, and 24/7 congregate care programs here in Massachusetts. And prioritized testing is also available for our first responders, healthcare workers, and grocery store workers in Lowell, in Springfield, and Foxborough. Today, we're going to expand those efforts at several more locations across the Commonwealth. In partnership with Quest Diagnostics and the Mass League of Community Health Centers, we will dramatically increase testing at several key community health centers here in the Commonwealth. As everybody knows, community health centers provide comprehensive health services for people across the Commonwealth. And these facilities are also deeply rooted in the fabric of their local communities. They're trusted partners in addressing the broad health needs of underserved populations. And they're committed to eliminating health disparities and facilitating access to health care for those they serve. Working with the Mass League, we've identified community health centers who have the capacity to ramp up testing and needs in areas of high need. And this includes many densely populated communities. Quest has agreed to ship 2,200 tests per day to 12 community health centers and is committed to adding more soon. The first group of health centers includes facilities and operations in Quincy, Brockton, Lowell, Fall River, New Bedford, Worcester, Provincetown, multiple sites in Boston. The Boston locations are Dot Health, East Boston Community Health Center, Codman Square Health Center, and the Whittier Street Health Center. Harbor Health Services will also have multiple sites coming online. People interested in being tested should contact these health centers this week. Each location is processing appointments differently.